Well, it's Thursday and we're ready to go live again with AirSculptTV. Before we do, I want to show you some results behind my head here. And for anyone who watched last week, and if you didn't, please look on our Instagram and you can actually see the video. But we did her last week. So this is just a 1 week before and after. She's going to look a million times better in a month. But I just want to show you before after. So we did tummy and back brow roll, and many of you watched it. Look at this back brow roll. Like, I don't know what to tell you, but for 1 week, I'd love to see any technology that can do better on Earth. So I'm just delighted, and we're so happy for Leah. And Leah was so happy to share these images with us. We promised her we'd get rid of that back brow roll and that pooch, and we definitely did. But again, 1 week is just the tip of the iceberg. She's only going to look better and better and better. So I just want to make sure we could share that with you. And now what we're going to do is go live in Sacramento. We haven't gone there in a long time. And we're going to do a patient's tummy who wants to get bikini ready. So without further ado, we're going to go live in Sac. I like all those hearts. I'm very proud of these results. I mean, this was done in Charlotte for all those wondering. Hi, how you doing?
Hi, Dr. Rollins. How are
Is
you?
that you, Katie?
Good. I'm doing good. We're here in Sacramento. We have Lucy right behind the door. She's getting her full abdomen done today.
Great. Well, let's meet her. Let's learn
All
about
right.
her.
Let's go in and we'll chat with her.
Okay.
Hi, Lucy. How are you doing? Good. All right. Let's get you over here. All right. Here's our patient.
I hear that AirSculpt going. Hey, how you doing?
Good, how are you doing?
I'm doing great. Can we get the phone closer to her so we can see her?
Yeah, absolutely.
Thank you. Well, thank you for sharing with us. We really appreciate it, Lucy. I just wanted to know what brought you to Elite.
Research. Always trying to lose weight. Always working on it, but some areas just hard to get rid of. So I was looking into tummy tucks, the freezing thing, and this came up, and I thought, wow, this seems amazing. So I thought I'd give it a try.
And how's it going so far? Dr. Rossi, who's been with us, I think. Dr. Rossi, are you the doctor that's been with us the longest?
I think so.
I think so, besides me. Yeah. It's good to see you, Mayor.
Good seeing you too, Aaron. We're still kicking over here in Sac.
That's great. We're about to move into our new Sacramento location. We're all super excited about that.
Oh, amen to that.
Oh yeah, I'm sure. Lucy, how has the experience been so far?
So far, wonderful.
And how much does it hurt?
It's not hurting, it's just a vibration.
Someone told me yesterday it feels like one of those thumper massagers, those massagers.
Oh, the massage
Yeah.
guns?
Yeah.
I
Yeah,
like
I have
that.
one of those too. Yeah, that's what it feels like.
Oh, it is, huh? That's cool. I love that. And I want to hear about your goals. I heard through the grapevine that you have some trips coming up and you want to look good in a two-piece. Is that true?
Yes. Me and 3 RVs are going to Yellowstone, Wyoming, Colorado, Jackson Hole. Going a couple
That's
week
great.
trip will be fun.
Those
Yeah.
sound like good trips.
Yeah.
Are you getting air sculpted right now?
Yes.
Okay, can we watch that a little bit?
Yeah.
Katie, can you, let's just show. So
Yeah, we're doing.
Dr. Rossi is air sculpting her tummy, and that's being done as we interview her. And Lucy, you're saying it feels like just vibration or what?
Yeah, like a vibration in my skin.
Wonderful. I love hearing that. And what kind of music were you listening to before we went live?
Country.
Anyone in particular?
No, I like all of them.
So you said you did your research. What would you tell people who want to look better in their clothes, who want to get body contouring, et cetera, who are looking at all the different technologies, now that you've done the research and now you're here on this table?
Yeah, this is something new to me that I never heard of before until I started looking at tummy tucks and then that freezing, body freezing thing. And I always wonder, like, how does that, besides the lipo, how does that actually leave your skin? So this, watching the skin go away and not coming back is the best.
You'll see your skin tighten really well too. So
Yeah, I'm excited
yeah,
about that.
no one believes it until they see it. So I'm looking forward to your skin tightening. And
Yeah, I've had two beautiful kids. They're adults
okay,
now, and
so it's a little bit of a mommy makeover too.
yeah, I should have had it done years ago.
That's wonderful. I think your daughter just got wet on our Instagram and said, "Love you, Mom." Stevie.
Love you too, honey.
That's adorable. That's never happened in the history of AirSculpt.
I think she's right next door in the recovery room.
Really?
Yeah.
Yeah, they were
That's
excited.
awesome.
We didn't realize it was going to be live on Instagram, but that's fine. And
That's so cute. What's it like to see your fat removed before your eyes? Have you actually seen your fat?
I saw some earlier.
What was that like to see it just fly out of your body?
It's the best. It's the best to know it's not coming back.
It's not coming back, no.
Yeah, not coming back.
Well, that's great. I'm just really happy you could share this experience with us. And anything else you want to say to people watching who are considering having AirSculpt or some form of body contouring?
I think it's an amazing experience. I would try that before anything else. Besides, keep working out and trying to stay in shape. You know,
Well,
I want to be healthy all my life. I'm pretty healthy.
I love that. Yeah, that's what we want for you too. Well, thank you so much for doing this, and thank you, Dr. Rossi, for letting us into the OR.
Thanks,
and
guys.
interrupting you, but Dr. Rossi is a legacy surgeon at Elite, and I'm honored to have him. So thank you for being with us, Dr. Rossi.
Good to see you guys. Have a great day.
Okay, take care, guys. Thank you so much, Lucy.
Thank you. I can't wait to see the results.
Oh, I can't. We're gonna show them. Just like
Yeah.
we showed last week's. Today we showed the 1 week. So take pictures, and we can't wait to show everybody how good you look. So, and I can't wait for you to go on your trip and have more confidence.
Yeah, me too.
Okay.
All right.
Thank you.
Perfect.
Enjoy.
Thanks, Dr. Rollins.
Okay.
Thank you.
Thanks, Katie. Take care. Bye-bye.
Bye.
So we're going to answer some classic tummy questions. We posted that we were doing tummy in Sacramento, and we're going to answer questions that are classic for tummy. So Lauren, go ahead.
Can this procedure allow me to have a smaller pant size?
Yes. If you have AirSculpt of your full abdomen, which for us is your full front of your tummy, your waist, and sometimes your hips. Many patients have a smaller pant size, dress size, etc. It's very, very common, and we encourage you, as I showed at the beginning of 1 week result, that is not your result. So don't go shopping yet, Leah. Wait, okay? Don't shop yet, because you will be wasting your money. You're going to get smaller. So great question, and yes. Next.
Up to how much fat can be removed?
We can remove up to 5 liters at one time. Now in 48 hours, you can come back and have 5 more liters. That rarely happens, but in certain situations, we do take out 5 liters or up to 5 liters, just below, and then we do other areas in either 48 hours or a week later or 2 weeks later, whatever makes sense for our patients.
What do the entry points look like?
The entry points are exactly 2 millimeters, which is the size of your average pencil lead, not pencil. And here is the device we use, and you can barely even see the hole. It's the size of your average freckle. So it's a new freckle if you scar badly, and if you don't scar badly, it's nothing at all. Looks like a pimple, and then it just heals.
Can I expect bruising or being swollen?
Everyone gets swelling. It's just a matter of how much. The body can't tolerate an empty space. If you create an empty space in the body, you have to fill it with some kind of water. And that's why you wear our special compression garment for 2 weeks. It's to decrease your swelling and help squeeze that out. But yeah, everybody swells. But you saw at 1 week, what did Leah look like? She looked a million times better, right? That's swollen, guys. That's swollen. So what people say, how much swelling will I have? Even with the swelling, you're going to be smaller than you were before you had AirSculpt. And I think that's all that really matters. Bruising. Everyone bruises differently. Some people bruise not at all, for example, behind my head. Some people bruise more than that, and it depends on how thin or thick your blood is. What about if you're a smoker? Great question. We don't encourage smoking. Smoking isn't good. Smoking is especially bad for fat transfer. It decreases blood circulation. We really don't want people to smoke before or after AirSculpt. We don't want people to smoke at all, but at least not around the time of the procedure, please.
What's the difference between local anesthesia and general anesthesia?
There's so many differences between local and general. The most important is when you're awake, just like you just saw with Lucy, when you're awake, you're a part of your procedure. You don't have to go through all of the things that we're all afraid of with general anesthesia. And you can actually be a participant in your procedure. I think it greatly reduces the invasiveness of the procedure. I think it greatly reduces your downtime and gets you results faster. But most of all, it makes our patients more comfortable to deal with.
Can I transfer this fat so that my breasts enhance them?
Yes, so we oftentimes do transfer your tummy and waist fat or any fat from anywhere in your body to your breast. We call it the upper cup. It's my favorite procedure. We do it every day all over America.
Someone's asking if she had a C-section before. Can she still get this?
Absolutely. Our C-section rule is as long as it's been 6 months since your C-section and you're not breastfeeding, we can really start your mommy makeover immediately thereafter. And can you do it if you have type 2 diabetes? Yes. A lot of our patients have type 2 diabetes, and we love treating patients with type 2 diabetes and help you get on a better trajectory with diet, exercise, and lifestyle.
What else do we have? Can AirSculpt tighten the skin?
AirSculpt does a great job of tightening skin. I like to tell our patients, and you can see it above. I mean, this is 1 week, and she's only going to get more and more tight. AirSculpt always leaves the skin tighter, not looser. So if you start with loose skin, it'll be tighter. If you start with tight skin, it'll be tighter.
All right. Someone asked if there's a weight limit.
There's no weight limit. There's no BMI limit. We want to treat everybody who has unwanted fat. Our motto is, if you can pinch it, we can take it. And that's what we do.
Is there an age limit for this?
There's no age limit. Our oldest patient that I know about is, I think, 86. Our youngest is 18. We don't treat people younger than 18. But if you're over 65, we ask you to have a medical doctor ensure that you're okay to have the procedure.
What about heart problems?
Well, if you have specific organ problems, we like to get your specialist to make sure that it's okay to have this done. So we do require medical approval if you do have health problems. But typically, doctors say, yeah, great, do it. I think it's actually good for you.
Is AirSculpt considered non-invasive?
It's considered minimally invasive. AirSculpt is a minimally invasive procedure because we do actually take your fat. We don't just bless it with a magic wand and hope that you're going to get skinnier. We actually take it through a hole that's exactly that big, freckle-sized hole. We take cell by cell, one at a time, but thousands upon thousands every minute. You get to see it, just like Leah did, just like Lucy did, just like everyone gets, just like you guys get to see it. And it's really out, and it's considered permanent. Oh, I saw a question, does this reduce your BMI? In many cases, it does. We're not a BMI reduction procedure, but removing all this fat at once could change your BMI in a positive way. But it's not the goal of the procedure. The goal of the procedure is to make you look better, make you feel better in your own skin.
Someone's asking, can you take it from specific places? What
Sure.
areas?
You can. We do all the way from the chin down to the ankle. So there's really no area that we don't do between the chin and the ankle. How long after giving birth? Great question. Here is our rules after having a baby. 3 months after a regular delivery and 6 months after a C-section. However, if you're not breastfeeding and you don't want your tummy done, we can do it anytime you want. So we just want to be careful in the tummy area and the abdomen. Anything else is fair game if you're not breastfeeding, whether you had a C-section or a regular delivery.
Great.
Well, that's about it for today. I want to thank everyone on Instagram who gave us questions. I love that. And we want to start looking at your questions while we're interviewing patients so you guys can interview the patients too. So we look forward to that moving forward. And thank you for watching. And so proud of Leah, and I'm sure all of you are too. And she's only going to look better and better. See you next week. Thank you.